Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to share with you 10 of the most common exercises early on after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos. So let's jump into it. Probably the most common one, you're going to do this basically as soon as you're out of the anesthesia, you're done with surgery, same day as surgery, is ankle pumps. So you can do this essentially in any position you want. You're just pumping your ankles up toward your head and pumping them down like you're pushing on the gas pedal and doing that back and forth. The importance of this exercise is just early muscle contraction of your calf muscles, which is going to help pump the fluid through your legs, help reduce risk of a blood clot after surgery. It's a really important one. Same day after surgery, first couple days after surgery as well, as pumping those ankles throughout the day multiple times as you're sitting and resting and relaxing and trying to recover. The next one I have is quad sets. So quad sets are important for knee extension or straightening, especially early on after surgery. We really want to try to get that straightening and extension back early on in the first few weeks. And also it's very good for early activation and strengthening of your quadricep muscles of your thigh, which can be atrophied, which are for almost essentially everyone, atrophied and weak after surgery. So I like to roll up a towel roll and put it right under the heel. You can use a pillow if you want, whatever it may be. And if you don't have anything, honestly, you can do this with the leg just flat on the surface as well. So you're usually going to be in this kind of long sitting position, or you can lie down on your back. And all you're going to do is think about pushing your knee down into the surface. So as you push that knee down into the surface, you'll feel your quadricep muscles contract and squeeze tight. You'll also see that you're getting that knee extension, that knee straightening range of motion. Trying to get to 0 degrees is our goal, completely straight. Again, pushing that knee down, contracting those muscles tight, and then relax. The more that you can do this throughout the day is the better, especially early on. Usually I have people do 10 to 12 repetitions, usually holding it for about 3 to 5 seconds each time, doing it multiple times, again, maybe 3, even up to 5 times early on throughout the day. So really trying to do that a lot to get that knee extension, that knee straightening back after surgery. The next one is going to be heel slides. So this is focusing on your knee flexion or bending. I like to use the strap as an assist. You can use a belt, you can use a rolled up bed sheet, anything that you can wrap around the ball of your foot, and you'll see why. For this one, I really don't like doing it in this upright sitting position because you start to get some pinching and discomfort in the hip. So really it's much better if you do it lying down. But I'll sit up for a moment just to describe what we're doing. So you want the strap or whatever you're using around the ball of the foot, and then you're just going to slide your heel up toward your bottom, and as you do so, you're going to bend or flex your knee. So I encourage people, don't pull on that strap right away. Do as much as you can just by sliding the leg, just using the muscles of your leg to bend that knee. Then when you get to this sticking point at the top, when you feel like you can't bend any further, that's where you give that extra little tug, try to get a little, a couple more degrees of bend, hold it for maybe a few seconds, that's all, and then just let it relax back down. So again, slide your heel while bending your knee up, get to that sticking point, give an extra little tug, hold it for a little bit, and then relax back down. Same thing with this exercise. Usually we'll do 10 to 12 repetitions for 1 or 2 sets. And again, doing this multiple times, especially early on, maybe 3, even up to 5 times a day early on after surgery to get that flexion, that bending range of motion. The next exercise is more for strengthening of your hips. So we really want to be aware of the muscles throughout your legs, especially up in your hips, your gluteal muscles. just to encourage good movement, good mobility after surgery. So we're not just focusing on the knee joint and the muscles around the knee, we're also focusing on the hips. So 2 good exercises. The first one is going to be bridging. So lying on your back, you're going to bend your legs up so your feet are flat on the surface that you're on, the bed, the mat. And then all you're going to do is try to lift your hips and pelvis up toward the ceiling. So you're going to go up and then down. A couple of things with this exercise is sometimes people will get some cramps in their hamstrings in the back of their thigh. If you're starting to feel that, you can think about doing some positional changes. So one is doing what we call a posterior pelvic tilt. The easiest way to do that is while you're lying down, before you start, just think of flattening your back into the surface. So as you flatten your back, you'll feel your hips and pelvis do a tilt up toward your head. That's a posterior tilt of your pelvis. Once you're in that position, you can try the bridging up and down. This will take a little bit of pressure off of your low back and also try to activate your gluteal muscles a little bit more rather than being more of a hamstring dominant movement. Again, 10 to 12 repetitions, doing maybe 2 sets, multiple times, 2-3 times throughout the day. That's bridging. The next great exercise, easy one after surgery, easy one to start, maybe not easy to perform initially, but is clamshells. So you can add some resistance with the clamshells with the band around the legs. Early on, if that's a little challenging, you can definitely just do the clamshells without any resistance band as well. And for clamshells, you're going to lie on your side, having your knees and hips bent, both about 40-45 degrees or 30 to 45 degrees or so. You'll find with some practice what the right spot is for you. And what you're going to do is keeping your feet together, you're just going to lift this top knee up. And I like to put my hand here as kind of a cue for keeping good alignment in my hips and pelvis as I do this. So again, nice and slow and controlled, including on the way back down. We don't want to just flop the leg back down. Everything wants to be nice and controlled. So we'll do about 8 to 12 repetitions, 2 or 3 sets. And then it's important to switch sides and do this on both sides as well. So that's clamshells, and that's another great strengthening exercise for your hips and your gluteal muscles. And then one more here. This one you might not do initially, but again on your back, you're going to bend the opposite leg up. Then you're going to keep your surgical leg as straight as you can, ideally perfectly straight. So you're going to have to activate those quadricep muscles of your thigh, and you're just lifting up to about equal with the other leg, other knee, and then back down. And this is straight leg raises. Early on after surgery, if you have a little bit of weakness, you'll have what we call an extensor lag, where you can't keep the leg completely straight. And if that is the case, then most likely it's better to do more of those quad sets and other strengthening exercises until you can keep that leg straight for a full set of maybe 8 to 10 repetitions of straight leg raises up and down like this. So again, that's straight leg raises. Another good exercise for contracting and holding that contraction of your quadricep muscles and building strength early on. So now we're going to switch gears. I'm going to get into the chair and show you a couple more exercises. Alright, here are a couple very common exercises early on after surgery that you can perform while sitting in the chair. So the first one is going to be seated knee extensions, or also known as long arc quads. You may hear them referred to as that. And these again are working on your knee straightening or extension range of motion, also early activation and strengthening of your quadricep muscles of your thigh. So sitting in the chair, good back support. All you're going to do is nice and slow and controlled, straighten that leg up all the way, trying to get the maximum amount of extension, really squeezing those quadricep muscles at the top of the movement, and then letting it come back down. And you're just going to go ahead and do that for repetitions. So maybe doing 8 to 12 repetitions, 2 or 3 sets. Always beneficial to try on both sides if you have the time. And doing that 2 or 3 times throughout the day. Again, for knee extension, knee straightening, and also early quadricep strengthening. As you progress and build strength, you can add ankle weights, which again will just build that strength in the quadriceps a little bit more, give you a little bit more resistance. Another exercise from the chair is heel slides. So this is working more on your flexion or bending range of motion. Usually you want to start with your leg somewhat out straight, doesn't have to be perfectly straight. And all you're going to do is, just like with the heel slides where you're lying on your back, you're going to slide your heel back, and as you do so you're going to bend your knee, and you can let your foot come back all the way. As you get back far enough, your heel starts to come up, that's perfectly okay. And then just let it come back nice and easy. At some point, especially early on, you're going to get to a sticking spot where you don't feel like you can bend much further. In that case, you can actually use your opposite leg and provide a little bit of pressure, trying to bend that knee just a little bit more, and then relax. And you can even use the other leg to let it help that leg come back out. So again, sliding back, get to that sticking point, give a little more pressure with the opposite leg, and then use the opposite leg to assist to slide the leg back out. So that's seated foot slides or seated heel slides to work on knee flexion range of motion. And then one more from the chair here is a really good strengthening one. This is strengthening for your quadriceps of your thighs, but also strengthening for your glutes. From the chair, we're just going to do sit to stand, so standing up and sitting down. If you can, ideally, doing it without the arms, so coming up and down without holding on. Early on, it's very possible that you have quite a bit of quite a bit of weakness, quite a bit of pain. So using your arms to push up to assist early on. I don't have arm rests on this chair, but I could push from the chair. That's perfectly okay. You just want to think as you progress, as you build strength, try to get to maybe where you can do it with just pushing up from one arm. And then eventually the goal would be to doing it without having to hold on and without having to use your arms to push up. With this one, again, we want to do maybe 8 to 10 repetitions, 2 or 3 sets, maybe 2-3 times throughout the day, really working on that strength throughout your legs. And this is also a good one for folks who may not be very familiar, well-versed in gym exercises. Doing squats might be a little bit challenging, things like that. A great alternative is the sit-to-stand exercise. And now I'm just going to switch gears one more time and show you the last of the 10 most common exercises. Alright, so the last of the top 10 exercises, especially early on after surgery, is going to be step-ups. Early on after surgery, having that upper body support of a railing or the wall or whatever it is nearby, definitely recommended, and definitely not a bad thing to do if you're feeling a little unsteady or if you have some weakness and pain after surgery, which is very common. So step-ups, easy enough. You're going to step up, get your whole foot on the step, and then just come up. Now, of course, there's a lot of different variations, but the simplest one is just step up and then step back down behind you. The leg that leads is going to be the leg that's doing the majority of the work. So you want to really do it with both legs leading when you're doing it for strengthening purposes. So usually I'll do maybe 10 or 12 repetitions with going up with the right leg first, 10 or 12 repetitions going up with the left leg first. Or the surgical leg and the non-surgical leg. When you're doing it just to get around, the motto up with the good, down with the bad. So you're going to lead with the non-surgical leg and then come down. You're going to lead with the surgical leg, up with the good, down with the bad. But if we're doing it for strengthening purposes, we want to practice leading with both legs up and down. So this has been the 10 most common exercises after knee replacement surgery. I hope you found this insightful and gave you some good recommendations and information. Please be sure to hit that like button. Again, please be sure to subscribe if you don't already. Leave your comments and questions below. Thank you very much for watching.